that seems like a logical place to start because of circulation. Okay. So, with the heart, you have your aortic arch, which 99% of the time branches to the left. That other 1%, kind of important for you need to know. I don't have an example for you here, but I'm not saying that it couldn't be a big possibility that it might show up at some point. And we could ask you, what's wrong with this rat? So, we have the aortic arch branching off to the left. There are 3 things that branch off of the aortic arch that you need to know. First one is your left subclavian, right there. Your left common carotid, right there. And this little trunk right here, which is your brachiocephalic trunk. Your brachiocephalic trunk then splits into 2 different things, which would be your right common carotid and your right subclavian. We can then follow your right subclavian through to all those arm artery places. So the first one that we look at that branches off is your internal thoracic artery, and seeing that it's inside the thoracic cavity, there's a reason they call it internal thoracic artery. Make sure when you're writing on the test, if it's internal thoracic artery is the answer, you need to write artery at the end of it, and you need to write that it's the right internal thoracic artery. So make sure you get all the parts of the question. Okay. So, see this little artery back here? That's going straight down?
Yes.
Rotating. It's going down. It's right under my blunt probe. Oh, that one. That little tiny one? That little tiny one? Everybody seen that little tiny one? That's your costocervical artery. Okay. You don't have to know intercostal.
Do you have to know the costocervical trunk?
No.
No?
No. We're not going to try and find it for you. Okay, so this one that's coming and branching straight back into the where your vertebrae would be. Can you guys all see that? I see it. The little pink thing directly above the blunt probe. Right there.
Oh, yeah.
That's your vertebral artery. Okay?
Can you point at it again?
Yeah. Right.
Where?
See that little pink one that's running right there?
Wait, no, it's red.
Right there. Different rat.
The one going straight back. Okay.
Should have
Good.
brought my own.
That one's costocervical vertebral. Let's see if I can find another one. All of these can be in a little different place on your rat. Because it just so happens that the circulatory system is one of the most variable systems for having things in different places than any other system.
How do you differentiate the internal thoracic with the
Costocervical?
Yeah,
The internal thoracic is this long one that and it's the first one that branches off to the side. The costocervical goes into the back and down. The vertebral also goes into the back. Then you follow this up, and let's see, nice one of you guys. Yeah. This one's a little larger, so I'll show you it a little bit more on him. See how it splits right here? Because it's still left subclavian right in that area. Left subclavian right here. But once you reach that V, right there, you guys all see the V? It becomes 2 different arteries. This upper one, right there, that's your superficial cervical artery, okay? the one that's right beneath it, that's going into the body wall, right there, that is your auxiliary artery. That auxiliary artery goes into the body wall and comes out right there. Can you see that? Everybody see that? Okay. See how it splits again? Can you see how it splits? D-shaped again? It's because it's splitting into two different things again. Whoops, I just broke your arm even worse. The one that's up here, you can follow that and see how it comes down right there. It follows the inside muscle in there. That's your lateral thoracic artery. The other one goes straight through again and follows through to the arm. And see how it's in the arm right there? That's your brachial artery. Makes sense because it's in the arm, right? Okay? Okay, and that's where we end with the arteries of the upper half. Then we use a different rat because his diaphragm's all messed up. Okay. So we come down and we see this green part right here. That's our dorsal aorta. That is this nice long pink thing right there. That's the dorsal aorta. Or not dorsal aorta, sorry. Descending aorta. Descending aorta. Okay? Branching off of the descending aorta first, you have your phrenic and your adrenal. Phrenic goes to the diaphragm, adrenal goes to the adrenal gland. So, right there, that one that's pink and is going up to your diaphragm, that's your phrenic. The one that's pink and is going to this little round brown ball, that's your adrenal. Okay? The adrenal is the one that's going to this little brown ball. Okay. Then we come down, and the next one that branches off is our celiac, and that branches into three separate things. So your celiac is pretty large because it has to further carry blood to three separate places. So there's that celiac. Let's see how your celiac is. There's another celiac. Okay. So, looking for the three branches of the celiac, you have one which goes to the stomach. Follow it all the way through right there. See how that goes straight to the stomach? That's your gastric. You have two which branches right here and goes directly over your spleen. That's your splenic or your splenic artery, depending on which package you read. And you have a third one back here. See if I move that gastric artery over. See that third one right there? That pink one? That one goes up to your liver. So that's your hepatic. Okay? So then we come down and we go over to this side because it shows you that one first. You have your right renal artery. Right there.
We did this on last Tuesday.
You guys all see that? So it's going directly to the kidney. Go over to the other side. Notice that your other kidney is a little lower. So it's right there. It branches off a little lower. In between those, you have this artery right here that's going to your intestines. That is your cranial mesenteric artery. it's going